Good afternoon, everyone, and welcome to my GT Mentorship final presentation. My name is IMahajan, and I am a senior at Travis High School. My mentor for this project was Miss Yolanda Fagbon, the practice administrator at the Center for Women's Health. And today I will be talking about BioT hormone therapy. So first, let's talk about hormones, which are at the core of my research endeavor. Hormones are one of the most important regulatory systems in our body. Their main function is to act as messengers that interact with specific target cells or organs in order to stimulate them into action. Now, a common problem is that as we age, hormone production changes, which can cause hormone imbalance to occur. In fact, in adults, hormone levels naturally decline by up to 10% each year. However, there is a solution for hormone imbalance known as hormone therapy. And BioT is a company that optimizes one's hormones using patient-specific bioidentical cardio-activated hormone pellets to help lessen the effects of imbalanced hormones in men and women. In recent years, BioT therapy is rapidly gaining in popularity. In fact, according to a study done by the University of Lynchburg, 47% of women in America suffer from hormone imbalance. And it's important to note that during puberty, menstruation, and pregnancy, a woman's hormones will be imbalanced. The study done by the University of Lynchburg took this into account, and the results correspond to the number of women who experience hormone imbalance outside of these specified times. So, with hormone imbalance, a common misconception is that it only leads to mood swings in women. In fact, when I first started this project, I thought that hormone imbalance occurs after menopause and it only causes hot flashes. After researching this topic, however, I discovered that it can also cause sleeping problems, foggy thinking, problems with digestion, weight loss or gain, heart disease, and even breast cancer. Now, my project is specifically about hormone therapy and how it alleviates some of these symptoms. But it's important to note that there are other treatments for hormone imbalance. Women can also utilize birth control pills, patches, or hormonal creams. The main difference between these methods and BioT is the level of convenience. With pills, you must take them at the same time each day. Patches can become bothersome when working out, and even creams can rub off on clothes, preventing the patient from receiving the full dosage. BioT, however, with BioT, the pellets are injected directly into the bloodstream, and this is done as an outpatient procedure, so it's relatively quick and it generally lasts 3 months. So patient hormone levels are kept consistent throughout the day as the pellets slowly release hormones directly into the bloodstream. So to continue with our discussion of BioT, getting the procedure done is fairly simple. It occurs in four main steps. First, patients are required to come in, give a blood sample, and complete a health assessment detailing the symptoms. Next, the patient's health information is inputted into the computer, where the BioT algorithm analyzes their data and determines the appropriate dosage for each individual. Based on the suggestions from the computer, the doctor then decides how to administer the hormones. They're either given as supplements, which are basically pills, or pellets, which are injected into the bloodstream. Then, although the procedure does last 3 months, patients come back for a follow up visit about 5 weeks after the procedure. At this checkup, they are given another health assessment to track any changes in their symptoms. So, with this elaborate process occurring, it begs the question, is BioT and its method of using pelleted hormones effective? So, customized bioidentical hormones are often advertised as being safer, more effective, and more natural compared to other forms of hormone therapy. However, these claims remain unsupported by any large scale study. Now, don't get me wrong, the ingredients used are usually FDA approved, but the compounded versions of them to make the patient specific combinations may not be. In fact, pellet therapies, as well as other compounded hormone products, are not required to meet the strict regulations that the FDA puts on medications. Rather, they are treated on the same levels as vitamins and nutritional supplements. So, in other words, there is an immense lack of FDA oversight for compounded hormones, which not only generates additional risk regarding the purity and safety of these treatments, but also undermines claims regarding its effectiveness. So, with all the uncertainty regarding the effectiveness of pelleted hormone therapy, I was curious to know whether BioT patients experience an improvement in their overall health. My research project tracked the changes in patients' symptoms as determined by the health assessments they filled out. And this research endeavor was undertaken to determine whether or not BioT was an effective form of hormone therapy. So the first picture on the left shows part of an assessment, and as you can see, it asks qualitative questions with answers that range from never to very severe. Each answer is then given a numerical value from 0 to 4, which brings me to the second picture on the right, the scoring table. At the end, all the scores are added up, and each patient is categorized based on the severity of their symptoms. So for my project, I obtained the before and after health assessments for 30 patients and added up their total scores. Here are my results. Now, the table in the graph did not clearly demonstrate BioT to be effective or not, as patient data generally varied. For example, patient number 9, as you can see here, went from a very severe score of 65 to a moderate score of 25, indicating that BioT effectively addressed their needs. On the other end, however, patient 24 went from a moderate score of 38 to a severe score of 50, indicating that BioT was not an effective form for that treatment for that patient. So from this data, I decided to perform a statistical test in order to determine significance. The test I chose was a matched pair t-test and a confidence interval because I had two sets of data from the same sample. So starting out with my parameters, I was looking for the true mean difference in scores from assessments taken before and after the procedure. Now, what this means is that for each patient, I subtracted their pre-assessment from their post-assessment score. Then through this test, I determined if the average mean difference was significant enough throughout the data. Before I performed the test, I established my conditions and made sure to randomly select my sample, ensured that the results were independent of each other. My sample was less than 10% and it had at least 30 pieces of data, and the data was paired since the same person took the same test before and after. So the test demonstrated that there is enough evidence to prove that the procedure leads to a decrease in assessment scores. Now, it's important to note that assessment scores and BioT effectiveness have an inverse relationship, meaning that as assessment scores decrease, we can conclude that BioT was more effective. So, following the match pair t-test, I decided to perform a confidence interval to determine the amount by how much scores increased on average, by how much scores decreased on average. So, from the interval, I concluded that the true mean difference between assessments taken before and after the procedure is between negative 20.3 and negative 8.5. This indicates that on average, patients experience a decrease in their scores by approximately 8.5 to 20.3 points. So, in conclusion, from these findings, I determined that BioT does lead to an improvement in severity of symptoms among women, indicating that it is an effective hormone therapy method. It's important to note that my research was limited to specific demographics due to the fact that the clinic where I was mentored served mostly African patients. Also, not many BioT patients were male, so I was unable to get a sample that was representative of the total population. This research could be improved by expanding these demographics and focusing on male patients or even women of various races. This would provide us with a more accurate sample and properly elucidate whether or not BioT is an effective form of hormone therapy for all individuals. Further research on this topic could also benefit the fields of endocrinology or psychiatry. An endocrinologist focuses on hormones in gland, yet this field is dominated by research into new techniques. The hormones that I focus on in this presentation, estrogen and testosterone, are mainly related to the reproductive system, but hormones have a broad range of functions and are responsible for many different processes in the body. By proving that BioT decreases symptoms of reproductive hormone imbalance in older individuals, further research could assist other patients that have symptoms caused by imbalance but are unrelated to reproduction. Which brings me to the field of psychiatry. So now a psychiatrist could use this research to recognize symptoms such as depression or mood swings as signs of hormone imbalance and possibly prescribe BioT as a treatment option. In fact, BioT uses bioidentical hormones, meaning they are chemically similar to what our body naturally produces, compared to regular hormone replacement therapy, which uses synthetic hormones made from ingredients such as the urine of pregnant horses. In conclusion, while additional research may be needed to apply this to other fields, this research endeavor did prove BioT to be a successful method when attempting to decrease severity of symptoms due to hormone imbalance in older women. So here are my references. I use a couple of academic journals and court cases to support my discussions. Before I end my presentation, I also wanted to thank my mentor, Miss Yolanda Fagbon, as well as her team at the Center for Women's Health for answering all of my questions and guiding me through this research endeavor. Thank you, Ms. Fagbon. And that concludes my presentation. Thank you for listening. And if you have any questions, feel free to ask.